All right, today we're going to dive deep into the logic behind one of the world's oldest medical traditions. Yep, Chinese medicine. We're going to look at its classical texts to see how they reveal this really unique way of understanding health, sickness, and the human body itself.
So let's start with a big question, just to kind of frame our thinking here. I mean, think about it. In a time before labs, before x-rays, without a single one of our modern diagnostic tools, how on earth did a doctor figure out what was wrong with someone? And maybe even more importantly, how did they actually heal them?
Well, the answer is they had to develop a completely different way of looking at things, an entirely different paradigm. See, for them, it wasn't about hunting down and isolating one specific virus or bacteria. Nope. It was all about learning how to watch, how to listen, and how to interpret all these subtle, interconnected signs the body was already putting out there. It's like they were reading a hidden language. Okay, so this different paradigm brings us to our first big idea, the virtuous healer. It's about a different kind of doctor. And here's the thing. For a classical physician, the path to becoming a healer didn't start in a science lab. It started with philosophy, with ethics. And just listen to this quote. It's from a text written almost 800 years ago. And it says, "A physician who is not a person of benevolence and love cannot be entrusted with a life." I mean, wow, that makes it crystal clear, right? The absolute foundation of medicine for them was compassion. Technical skill was important, sure, but it came second to the moral duty of just caring for another person. So here's a way to really see that fundamental shift in perspective. On one hand, you've got the technician who asks, what is the disease? Their focus is on identifying and naming the problem, the what. But then you have the healer, and their first question is always, who is the patient? It's all about the individual, the who. Who is this unique person standing in front of me, and what's the story their body is trying to tell?
Okay, so if the focus is all about the patient's unique story, then the next logical question is, how do you even read that story? And that brings us to the art of investigation, this process of decoding the body's language. And this leads us to probably the single most important concept in this whole system, pattern differentiation. This is the absolute core of their diagnostics. So instead of saying, you have a cold, a classical doctor would see a whole bunch of things, a headache, chills, a specific kind of pulse, and see them as a single coherent pattern of imbalance. The goal isn't just to name the invader, it's to describe the entire state of the kingdom, the body's whole ecosystem. So, how did they build this picture of the pattern? They used what's known as the 4 examinations. This was their diagnostic toolkit. First, they just observe, looking at a person's spirit, their complexion, their tongue. Then they'd listen and smell, the sound of the voice, the breath. Third, they ask a ton of questions about everything from your symptoms to your history, your lifestyle. And finally, palpation, actually feeling the pulse in the body. Each one of these steps added another crucial layer to the puzzle.
All right, so once you've figured out the pattern of disharmony, what's the game plan? What's the strategy for treatment? Well, the ultimate goal wasn't just to kill some bug. It was all about restoring the body's natural sense of balance, its harmony.
Now, if you think about a lot of the modern medicine we're familiar with, the strategy often boils down to this. Attack the invader. You find the bug, you find the virus, the rogue cell, and you go after it directly. And look, it's an unbelievably powerful and life-saving approach for so many things. But the classical approach was, well, it was the flip side of that coin. Instead of attacking the invader, the strategy was to fortify the kingdom. The focus wasn't on the bug, it was on the body itself. The whole idea was, look, if the body's own environment is strong and balanced, then those outside invaders can't even get a foothold to begin with. And this quote from an 18th century text just nails it. It says, the real skill is to support the body's righteous qi, enabling it to expel the pathogen on its own. So what is righteous qi? It's just a way of talking about the body's own built-in integrity, its vitality, its natural defense system, what we might call the immune response. The doctor's job isn't to be the hero, it's to support that vitality so the body can do what it's designed to do, heal itself. Okay, so all this theory is fantastic, right? But what does this actually look like when a patient walks through the door? Let's put the pieces together and walk through a quick, simplified example of an earth-wrenching diagnosis. So imagine a patient comes in with this set of clues. They've got a fever, but they also have chills at the same time. They feel hot, but they're not sweating at all. They've got general body aches, and then the doctor feels their pulse and says it feels floating and tight. Now, to us, that probably sounds a lot like the flu, right? But let's see how they would read this pattern.
And this is where that whole idea of pattern differentiation just comes alive. So those fever and chills, that signals a battle going on between the body and what the old texts would call an external wind-cold pathogen. And the fact that there's no sweat, that's a huge clue. It means that pathogen is kind of locked down the surface of the body, blocking the pores and trapping everything in. And the pulse, that floating quality, tells the doctor the fight is happening right at the surface, while the tight feeling, kind of like a guitar string, shows that the body's defensive energy is engaged and fighting hard.
So you put all those clues together, and what's the diagnosis? It's not a disease name, like the flu. It's a pattern name, Tai Yang Wind-Cold. And that name is a complete battle plan. It tells the doctor exactly where the fight is, at the Tai Yang, or the most superficial level of the body. It tells them what the nature of the fight is. It's a wind-cold invasion. And because of that, they know the exact strategy they need to use to help the body push it out.
So, as we wrap up, what's the big takeaway from all this? This ancient system leaves us with some timeless questions for our own health. It's so much more than just a collection of old remedies. It's a really profound way of thinking about what it even means to be healthy. It's an enduring legacy.
And you've got to remember, this isn't just some dusty ancient history. We're talking about a living tradition. It starts with foundational texts from almost 2,000 years ago. It evolves through philosophical works in the 1200s. It gets compiled into massive imperial projects in the 1700s. And today, these exact same principles are still being used in a global system of medicine. It's a living, breathing thing. And so, this ancient system leaves us with a really simple but really powerful question for our own lives right now. It forces us to stop and think about our own approach to health. Are we just focused on treating diseases, or are we really trying to heal people? It's something to think about.